So I see a lot of different knee issues, but the most common complaint I get is medial knee pain when trying to do a squat. So this is caused by a number of reasons, but it's primarily due to the hips being stuck in internal rotation, which is caused by the glutes being turned off and overly tight hip flexors, and also overpronation of the foot. So essentially, the foot has collapsed inwards due to the loss of arch through the foot. So we've got to restore the arch in the foot and also get the mechanics of the spine and hips back in alignment. In order to get the hips stuck out of internal rotation, we've got to get the glutes to fire properly. And they're not going to fire properly if the spine is stuck in this forward position, because every time you go down to do a squat, the low back seizes up in order to keep you from pitching forward, which takes a lot of the tension and the activation out of the glutes and the legs. So once we get the spine back into this more stable, upright position, the spine stays naturally upright when you're going down into a squat, and that tension shifts more to your glutes, your hamstrings, the muscles you actually want to be activating during a squat. So after we've fixed the spine, we'll correct any fixation in the sacrum or the pelvis. So if there's excessive rotation going in or out or up or down in the hips, or if the sacrum is misaligned going backwards one way or the other, or twisted down by the tailbone, that can cause hips to not be able to open properly on one side, and that'll cause further knee misalignment. So the last two things would be to correct the collapsed arches, which cause overpronation and that internal rotation into the knee joint. So you'd want to push them back up in a superior direction where there's no muscles for the body to actually self-correct these bones. And then we'd address the tight hip flexors, which, the psoas muscle that crosses the hip joint. And when it's really tight from chronic sitting most often, the knee will be pulled into that internal rotation, especially when we're trying to squat. So releasing that will allow the knees to come out, as well as allow the body to remain more upright. So as you've learned from this video, chronic knee pain is typically not an issue localized to the knee. It's a whole body issue. So we address everything from head to toe. We restore the stability, the mobility, and the strength back to your body. So if you're looking for a solution to your chronic knee pain and want your body functioning better than ever before, then give us a call or visit us at theposturechiropractor.com. See you guys soon.